My name is Edward Ma. I'm a physician at Chester County Hospital, and I specifically specialize in hospital medicine, which is the care of hospitalized patients. With this COVID pandemic, this has been a great opportunity for us to work as a team between physicians and the rest of the staff, which include nurses, nurses' aides, physical therapists, the entire staff. We've been able to come together and really share in our responsibilities in caring for the patient. This period of practicing medicine has really shown us the importance of teamwork. I'll say I'm gowned up already, and let me help and take care of this or that, which includes everything from feeding a patient to turning off a beeping IV pump, which is something the nurses make look much easier than it really is. And in these times, the nurses help me out by taking a picture of a rash so I don't have to gown up a second time to look at it, or they will sometimes communicate something to the patient, which normally I would do so in person.
Well, when the pandemic first started, it didn't change much. I continued to work on my observation floor, but as census dropped, they eventually closed my floor, and we became staff to the COVID floor.
There's a lot of steps involved to removing our PPE. I perform hand hygiene about 9 times when removing my equipment. On Sunday, May 3rd, I was working in my garden with my 2 children. And as I was laying down planting soil, I naturally inhaled some of the fumes. I started to cough a little bit, and it lingered for about 2 days, which was easy to chalk up to the gardening. At first it didn't really bother me, but then I started thinking, well, I hope this isn't COVID. So I was checking my temperature because I was already a little suspicious about this cough. It was about 100.5, and I said, all right, well, that's definitely a real fever. I gotta call my boss. I let him know. And so he said, all right, don't come into work tomorrow. We'll schedule you for a COVID test. So I go to the employee health center, I get my COVID test, and about an hour and a half later, I get a call back saying that I'm positive. The way the hospital supported me was that they had people that were available if I had any questions. There's another person that was working downtown. She called up to just to see how I was doing, to inform me of the results and ask me if I had any questions. So basically I had 2 people calling me to let me know my results and to sort of check in on me to answer my questions. The way my experience has affected me and perhaps even changed my practice is it's very important for people to be able to communicate with one another. What's going on with this pandemic, with everybody being isolated from one another, everybody's feeling a little bit of that loneliness, isolation. We've encountered a lot of obstacles in terms of communication. As our faces are completely covered with masks and goggles, patients aren't able to see our faces, so I taped a photo of myself to my gown. Rather than seeing a faceless person come in, patients can look at a picture of me, and I hope they can find that a little bit more comforting.
And we also set up Blue Jeans with the family and the patient for a virtual visit, which everyone just loves. When I first started on the COVID floor, I actually had 2 patients pass away, but both times I was able to be with them. That was a blessing for the patient and hopefully the families to know that somebody was with them. So looking back on this pandemic, one of the lessons learned would have to be flexible. Things have changed daily as new things are learned and new policies come out.
I think it's still important for us to exercise caution out there. We still don't know the full extent of this illness, of this virus, but it's important for us to still listen to the public health officials. And even though there may still be some conflicting information out there, I think sometimes it's really, the burden may be upon yourself to assess what level of risk you're willing to take. So if you need to come to the hospital for non-COVID related issues, I would say this is a great time to come. Our hospital has taken many steps to prevent people from getting sick. Anybody that's going to be coming to the hospital is thoroughly screened and thoroughly managed if they are COVID positive.